Cold morning, especially for those of us that drove up from some of the warmer climates that I'm a little envious of right now. We'll start this meeting with the Pledge of Allegiance, if you'll please join me. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Hard to believe I've been saying that for so many years, since first grade.
Just a few.
I'm not going to tell you how many years that is because I understand we don't have to do that anymore. So could we ask the secretary now to do a roll call?
Yes. Board of Supervisor Gene Bishop.
I am here.
District 1, Hunter Adams.
I am here.
District 2, Terry Cole. Districts 3, Nancy. I have your last name.
Nancy Monjo. I'm here.
Manjo.
Monjo. Yeah.
Citizen member Kalshigi.
Here.
Citizen member Sandra Thomas. And physician Dr. Wade.
I'm here.
And we have quorum. Thank you.
Okay, thank you. Do we have anyone here for the call to the public? I see none. So we'll close the call to the public and go on to welcome the new members. Terry Cole, I believe, is the new member.
Yes.
And
Terry was unable to, with the short notice of just getting put in last week, the short notice, but we'll be adjusting his schedule to attend future meetings.
okay, and then we have Sandra Thomas, who's returning.
Yes.
So we thank her for that. Kurt Manley, who is representing my district, has put in his resignation, but I certainly want to take this opportunity to thank Dr. Manley for his service and for his dedication. And it was with great sadness that I accepted his resignation, and I am still looking for a member to appoint for District 4. So maybe at the next meeting, I'll have that person selected. Okay, we now have a presentation by Sherry Mentor with the program coordinator, Opiate Overdose Data to Action Program. Welcome. The podium is all yours. You're welcome.
So good morning. My name is Sherry Minter. I'm with the Mojave County Department of Public Health, and I am the program coordinator for the Overdose Data to Action program. I'm here today to talk to you guys about naloxone or Narcan and what my program is doing with that. So first, give you a little description. Naloxone is a medicine that can reverse an opioid overdose. It's an opioid antagonist, and what this means is that it attaches to the opioid receptors and reverses and blocks the effects of opioids in their brain. Quick explanation. It has no effect on someone who doesn't have opioids in their system. I like to point that out because a lot of times if somebody is overdosing, most of the time we don't know what they're overdosing on, and so this is just a kind of a way to rule out whether they have opioids in their system or not. So it has no harmful effects if they don't.
Interesting. I didn't know that.
Yeah. I will mention that it's not a treatment for opioid use disorder, and some examples of opioids would include heroin, OxyContin, morphine, hydrocodone, codeine, and of course fentanyl, which is a lot of what we're hearing about these days. So my program, the Overdose Data to Action program, what we do is we work to spread awareness in the community on opioids, fentanyl, and then the dangers that follow. And then with that, we promote and educate awareness on naloxone within the community. So we provide naloxone trainings, and then of course we hand out naloxone kits to those who need them. In most cases, we like to encourage friends and family members to be in on these trainings, know about naloxone, have it on hand, keep it in their first aid kit, because for those who are overdosing, they're not going to be able to use it on themselves. So we really just want the whole community as a whole to be aware of it. Let's see.
I have a question.
Yes.
I do keep that in the glove compartment of my vehicle for emergencies such as you just described. Does the heat in the summertime have any effect on it?
It can. So on the box itself, it tells you the highest heat is 104. So we all know in summers here in Arizona and being in the car, it's probably not a good idea.
Good to know. Okay.
Yeah. That's what it recommends on the box. I can't say that it won't absolutely work, or at least, have some kind of effect if it has gone over 104 degrees, but that's just what's suggested.
Is there any harm with giving a double dose? Like if someone like me gave a dose and they were, it wasn't reactive,
No, absolutely
and a
not.
second dose wouldn't have an adverse reaction?
Nope, absolutely not. I was going to mention this earlier, but so fentanyl is 50 times stronger than heroin. And so a lot of times what we're finding is that those who are overdosing, they need more than one dose. And so we always stress to call 911 first before you administer, so at least they're on the way. EMS or law enforcement are on their way, because if you only have one, they might need additional ones. And I also do the overdose fatality review. So a lot of cases that I've come across, they've administered 4 to 6 if the person has used fentanyl. So again, it's not harmful. Yeah.
Thank you.
Can I ask a question?
Yes, go ahead.
Do you distribute free of charge?
We do, yes.
So people can just come to the public health department, or is that how it works?
They can. Yeah, so my program, what we're working on right now is we're going to become the hub for distribution for all of Mojave County. This is going to exclude hospitals and law enforcement, though. So hospitals and law enforcement will still go to Arizona Department of Health Services to get their naloxone supply, but then the rest of the community agencies, community members, they would all come to us. And so we're working on updating our webpage on the Mojave County website for my program, and it'll have a request button on there. So it'll have information on naloxone and other things that we do in our program, trainings we offer. But there will be a request form on the website, so they can go there, answer a few questions, and then request naloxone through us.
I'm also on the Board of Education for CRUSH. Are you in high schools? Are you going to high schools?
We do go to high schools, and that's actually one of the school districts that we presented. We did a fentanyl and a naloxone presentation for the crushed school district staff, so it was over 100 staff, teachers and staff. So we did it through them, and we have provided a few of the teachers, upon request, some naloxone as well. But I do also have one of our employees in the Bullhead office. She teaches at, I think she's in 4 different schools in the Bullhead City area.
Junior high also?
She's in Fox Creek Junior High, Bullhead Middle, Mojave High School, and Sunrise Elementary.
Great.
Yep.
Thank you.
Yep, you're welcome. So overall, the response from the community has been very grateful. A lot of times in community events or when we're doing a naloxone training, a lot of the community members seem to be pretty grateful that we offer this for free, and they're very sharing of some of their experiences, whether naloxone has worked or somebody that they know who is addicted. So again, they're very grateful. The other thing that we've done recently is we've started asking pharmacies to put up a sign, just kind of letting people know that they can get naloxone from us for free, because if they're prescribed naloxone, they go to pick it up at the pharmacy. Sometimes there's a charge if their insurance doesn't cover it. And then the other folks don't want to pick it up because they don't want it on their record. So we are trying to place signs up to let them know that they can come get it for free from us.
Question, also for foster care and adoption, it's also required, right? Or some type of, to have naloxone or naloxone training?
It is required now, yes. And I have had a few reach out to us. The Arizona Department of Health Services has forwarded a few people to us. And I've reached out to a few foster parents to provide them some so far.
And I think that's a concern sometimes too because they have to show evidence that they have naloxone. And so somebody that's going to do foster care, they will, if they go and get the prescription for it, then it appears, it puts a ding on them for becoming a foster parent because it looks like they are somehow participating in opioid or fentanyl and stuff. And so sometimes that it's a little bit of a issue recently with foster care and adoption is that they need to get a prescription. They get the prescription and then they're marked as participating in illicit substance abuse. And so this is a great option for anybody that's in foster care that they just need to have the training and then have it in their home as part of their process. Then they don't have to go and get the prescription for it. So this is also a good option for them too. So, and I just learned that. So thank you.
Yes.
Naloxone is also, because I run Rose Garden House and we just got our license and the health department mandates that we have naloxone in a sober living house to get the license, so,
Very good.
yeah.
Okay, any other questions?
What are your plans for the next future? I know, so just for the board, so. What are your plans for this next year?
Well, continue providing naloxone presentations to anybody who's interested. We've been out to Peach Springs once already, but I believe they're going to ask us to go out there again. We have a few industries, larger companies that are looking for the training and then also to, have Narcan on hand in their first aid kits. But outside of that, it's really just working to become the hub, working out storage, inventory, tracking, that kind of thing, and making sure our webpage is up and running and everybody knows about it. Yes.
I'm glad we discussed about this because this would reduce the stigma, like you mentioned. My quick question is how long can we store it? I think in the future it should be part of the defibrillator kits, any building, that's where we know, as healthcare provider, we know that's the source of device, that's a life-saving device. So I think naloxone should be one of those, and that would be a good place to store. So people always know, because right now if you go to a place, you said,
Yeah,
in crisis, you're like, where's the naloxone? People just look around, where do you store it? In your drawer somewhere? It's good to have a place for it, and I think that will be the future, hopefully.
Absolutely. I did a training with the Superior Court staff and bailiffs, and afterwards they purchased bags to put the naloxone in so that they can put it, in the AED kits. So I do think that that's a good place to put it. I know like with Sterilite, when we go out there, that's going to be a suggestion, for them, either in the AED kits or even the first aid kit, but
Great.
yeah. And then I forgot to mention too, the other thing we'd really love to do is get in with the emergency departments, to get them to either hand it out to those who have come in with an overdose or give them a prescription or send them our way. So working with the emergency departments on some of their protocols and procedures would be a next move too.
Okay, so I have a question. Will this be available to hand out through our new health and wellness van that'll be going out to the rural areas?
It certainly can, yeah. We hand them out at events. So yeah, I don't see why not. I think that would be a good place.
We're going to tie it to the van to have it there and promote to the communities so that they can come and get it there. So it'll be a distribution point for any of the places that we go. Yeah.
Good.
On another side point on this, and Cherie can be able to comment, but legislatively, there's a Good Samaritan law, and many times what everyone knows about the Good Samaritan law is, the general is helping or not helping someone, but there is a Good Samaritan law tied to an overdose. And it was part of a larger legislation which is going away, so it'll be canceled. And so this Good Samaritan law, essentially, if you were a person who was participating in illicit drug use with the individual that is overdosed, or that you were present and you called 911 and that paraphernalia, the drugs or paraphernalia, anything associated was present, you were protected by this Good Samaritan law, so you would not be arrested for drug possession. That is going away in March. So it raises the concern that if I call 911 and an officer responds, will I be arrested because I have drug possession, or, will it prevent me from doing the right thing, calling 911 to help this person in this overdose? It is being addressed legislatively, but there's not a big answer yet. There's not a whole lot on it, but it is going away in March. How law enforcement will deal with that when they are called. So it's being broached, and if it needs, I believe they want to maybe put it towards its own type of legislation instead of being tied to something so it doesn't go away. But that is upcoming, so just so the community's aware, as well as the board and stuff, that will shift possibly the responses to individuals who call on overdoses, but it is recognized by the state and being addressed, so, but no answers yet on that, so. Yeah.
Yeah, I thought it was June or July,
Is
but
it June or July? It might be June or July. I thought it was March, but maybe it was June or July. Yeah, don't hold me to the date, but it is this year.
it is
coming up.
this year. The Arizona Department of Health Service, they do plan to work to keeping it.
Yeah.
But yeah, we've been advocating for it and, spreading awareness of the Good Samaritan law just as long as, as well as other organizations have too. So yeah, I would prefer that one stick.
Yeah. Just overall, just anything that removes a barrier to assisting the access to care and such things and stuff. But yeah, so thank you.
Any other questions?
Yeah, Madam Chairwoman, I have a follow-up to that. So what mechanism is sunsetting that? That's legislation usually doesn't sunset. So is it a rule of the Arizona Department of Health Services where they don't have perpetuity?
It was, you hit it on the nail. It is something that is sunsetting. Do you remember what it is, Cherie? Melissa? Melissa's looking it up right now.
Yeah, we can take a look at
I would have
that
to
and see.
follow up. It's been talked like 3 times, but somebody that's familiar with it just rolls right through the title and where's it at legislatively, and kind of like, and then you get lost on the topic instead of remembering the exact name, what's being sunsetted and stuff. And that was the issue with it. It was it was a clause to a law or whatever that was being sunsetted. And so, it was like a minor something that was added, but now it's taking precedence because it's going away.
Sure.
So.
Okay, yeah, I'll take a look at it too, and we can
Yeah.
talk to our legislative delegation to see how we can solve that. On the Good Samaritan law, on the other side of that, are folks that are administering this, are they able to be protected from, say, a person that they administer Narcan
Yeah.
to, they are,
So there's 2 forms. There's injectable, and that requires, a medical license, but the nasal spray is a layman's approach, or whatever, so they are protected. And Dr. Nguyen? Or-
So we know when someone uses it, when you give the antidote, the patient will walk up and sometimes they can be very angry at you.
Yeah.
So you just be aware because,
And that's part of what the training is that you administer, you step back, you just,
Right.
you're on one knee, and just same as CPR, because a lot of times, they instantly lose, and sometimes they can be upset that they've lost their high. Yep, so,
yeah, we had that in the emergency department. And
yeah.
people really upset.
Yeah. And just to recognize too, we were one of 3 to 4. I believe M-STEP and a few others also within our communities has various grants for this. It's the amount of, obviously, we've been facing an opioid crisis within our county. And so we do have other organizations participating in this, but we're congruently working side by side, and sometimes it's still not enough. So this is our prevention time to be able to change the next generation, I believe, to give them the education they need to know to be able to prevent and move on from this. So, yeah.
Okay. So this was part of the Arizona Opioid Epidemic Act, which was put into place in 2018. And it was put into place by Governor Ducey, and when it came up for renewal, it was not renewed. This also ties in not only the law enforcement responding, the Good Samaritan law for law enforcement responding to a situation, it also affects the Overdose Review Board, which is what Shuri was also doing as part of her program. She was reviewing opioid overdoses that resulted in a fatality, and that also went away January 1. We were no longer able to look at those, and what happens is you look at that death and you look at what could have been done to prevent that death. So what happened prior to, what was the entire situation, everything from were there prescriptions involved, medical care involved, or other situations, and then they make a report back to state, right? And then state uses that to drive any decisions made at the state level for prevention of opioid deaths.
Yeah. Okay. And I'm currently working on that report now too. So from the 2021 cases.
Okay, well, thank you very much for your presentation. I think we all have taken more information away from this than we had when we came here this morning, so I appreciate it. Thank you so much. Okay, going on now to the consent agenda. Looks like we need to approve the minutes of the Board of Health meeting.
Supervisor Bishop, here. Yes. So I might miss that. Although there's no public here, did we call to the public yet?
Yes.
Oh, we did. Okay. Thank you.
Yes, there was no one for the call to the public, so we did close that and went on. So I'm looking for a motion
I
to.
make a motion to accept the minutes as written.
Okay, we have a motion to accept the September 28th minutes for the Board of Health. Do we have a second?
Second?
Motion is second. All those in favor indicate by saying aye.
Aye.
Okay, any opposed? Motion is approved. Thank you. Mojave County Public Health Director, update and report. Dr. Chad Kingsley.
Thank you. So as part of being Director of Health, I feel I am accountable to the county and its citizens as well as to the board and those parts. And this is in a week or so, that will be my 6 months here at the county. And just wanted to do a quick review, summary of activities for my position for the board and for the community. So over the last 6 months, directive leadership of the department, being present in Kingman, Bullhead, and Lake Havasu offices. I made that a point just for staff as well as for our community. For our department, interviewed and onboarded nutrition and health promotion and environmental health manager, and managed time and focus both proactively and reactively. Participated in the coordination and response to COVID-19, monkeypox vaccine, and the flu, RSV, COVID respiratory seasonal response. Prepared reports, action forms, and memorandums, and presented them at the Board of Supervisor meetings. Maintained open communication with the Board of Supervisors. Participated in and responded to media inquiries. I've participated both in radio interviews and newspaper interviews. Met and connected with community organizations and state officials at the Arizona Department of Health Services. Presented and attended at the Hualabai Tribal Council meetings and the Hualabai Health Advisory Board. Visited and met residents for Meadview, Chloride, White Hills, Dolan Springs, Colorado City, Yucca. I was looking at Lynn. I always mispronounce it, sorry. Yucca, Topak Golden Shores, Mojave Valley Oatman. I think I'm only missing Wikiup. I was not able to make it there, but I've been driving a lot, but been able to make it out to those communities and meet many of the residents there. Contributed to Mojave Valley's economic development meetings, visited and participated in senior centers, presented at and participated in Tri-City meetings, attended the Arizona Local Health Officer Association annual meeting in Bisbee, Arizona, and as well as monthly meetings. Attended a mobile unit health conference and helped finalize the ARPA monies development of the mobile unit. Performed duties as contract administrator for medical examiner. This included a very and still ongoing in-depth investigation and research into performance and acting as liaison for funeral homes and the Board of Supervisors. Registered as Vital Records, local registrar, and took the training for that. Participated in the public health emergency response for the storms that occurred in September and August, September. Developed relationships with Mojave County departments, and presented and participated in the Arizona Town Hall for Mental Health and Substance Abuse. So it's just an overview of my last 6 months and a summary of completely happy to be here. It's easy to fall in love with the residents of Mojave Valley and Mojave Valley. I've started that Mojave County and seeing who they are and what our community is and what it can do and all the wonderful things that are here. So and I also want to thank everybody for being so accepting and warm and stuff. So for a more immediate update.
First, I want to just thank you for taking such an active role in Mojave County Public Health and for attending all these meetings. I mean, I think we owe you a new set of tires for your vehicle. And yeah, you've been a very good fit for Mojave County, and I continually hear good comments about your performance and your ability to communicate with people. So thank you.
Great, thank you very much. So for just a update from our last meeting, our department, we had an all-staff development meeting, actually here in this room. And it was a great time for all our staff to get together. We had various trainings for mental health, naloxone, and community health, as well as just the opportunity for, so we don't feel isolated, that all our staff came together and being able to share and participate and strengthen our department coming off from the last few years where so much was stressed, but be able to really focus on how do we meet the health needs of our community. For update, on February 25th, Saturday, in Bullhead, there is a health fair at the Mojave County Community College being organized by several different organizations. There will be childhood vaccines, pet adoptions, which we're calling pet therapy, and numerous resources, not only from our department, but many other of the health-serving communities, from nutrition, and classes on nutrition, as well as presentations on mental health and various trainings. And so it's shaping up to be a great opportunity for that region and for the community. Yesterday,
I can speak from experience. Adopting a dog or even two is very good for your mental health.
yes, it is.
Not so much your physical health, but your mental health.
And not so much for your leather furniture.
Yeah.
True.
Apparently there are also 2 rabbits available for adoption too, so.
Nobody's taking those rabbits.
Nobody's
My
taking those
dogs-
rabbits. Yes. Last Friday attended, which is the Hilldale Luncheon, but it is a community event held by Hilldale for Hilldale in Colorado City, and this was its second annual retreat or luncheon where elected officials and state officials, as well as community members, come together and discuss the topics of that region. Many may not know, but Colorado City is our 4th incorporated city. Sometimes we see the 3 down here, and but realize that Colorado City is incorporated. They have made incredible strides, and it is a beautiful, beautiful area. It's a gateway to to Utah, to Zion, and many points. And so they're shaping up to develop that. And a lot of great things are going. We were able to tour a community center that's being repurposed. And the size of this building is immense. And I think it would make any city envious of what it's going to become. And so in about a year or two, they're going to have an amazing community center with STEM labs and performing arts and a kitchen as a commissary for new businesses. So a lot of great growth there and representation for our county. I always jokingly say a little bit, but they call the Grand Canyon the ditch. And I was there in one of the first meetings, and they said, well, the people on the other side of the ditch, and I laughed out loud at a prior meeting, but it's a great small town community, and it just kind of shows you how their cheekiness or whatever, and they're a great community coming up and report there. They do, from a health standpoint, both their mental health, suicide, and opioid are up to 300 to 900%. Obviously, it's a smaller town community, and so any variation in numbers, but those are two big points. And Hunter Adams is very much involved in that, and I thank him for that and all he does, and his organization, and much of the grants they go after, we support him because he's local, and we'll be able to support and back up Hunter's organization so that he's in the community and be able to make those differences. But just wanted to provide an update on that. But also for the next year, we'll be focusing and more active again in Colorado City, as well as all the communities, and helping to make a difference there. So where we can. Just an update, to continue to respond to funeral homes and medical examiners. Should be presenting to the Board of Health in February from our follow-up from our last discussion. A little bit more data was available, but overall, just continuing forward to provide transparency and data. The Board of Supervisors did approve a site and construction for the medical examiner facility. It is BLM land, so it'll be a little bit longer process of transitioning the ownership of that land to Mojave County. But it is located a short and respectable distance, isolated distance from Kingman, and it's right over here off Route 66 on the exit to Oatman on Shinnerup Drive. And so they'll be developing that, and that hopefully with 2.5 years. We have 2 years left on the medical examiner contract. So at that point, depending where the construction of building at, but my department will begin over the next few years developing policy procedures as well as staff and begin hiring for that. So that eventual process will be incorporated
That all comes together at the same time.
Yeah. So hopefully it does, yeah.
Hope that happens.
Yeah. And so part of my position too, in many counties or many states, is called SACHO. Everyone has acronyms, but it's State Association of City and County Health Officers. And in many other states, it can be a political organization. They watch legislation and they help contribute for and against legislative bills. Arizona, we didn't go that route. So our SACHO is called ALHOA, Arizona Local Health Officer Association. And so it has no political lobbyist. Essentially, it's each health director, we get together and we discuss. And we do provide recommendations to anyone who's needing, but we share resources, and strengths, and what's happening, trying to have a unified message. And it's a great organization to be part of. And it also, when we need something like what's happening in Yavapai, which a lot of times we get compared to in size-wise, it's a phone call, and so, hey, do you have this data? Okay, do you have this? And it's being able to share, but also resources during the last, for our flu and preparing and stuff. Yuma had prepared, material, marketing material for it, and they shared it, Arizona-wide. And so we also provide messages to ADHS, and ADHS is very much part of us, so it's a very strong connection to Arizona Department of Health Services. We meet in their buildings now, and we have direct contact with the bureau chiefs for health on many of these points. And also I'd like to announce that Dr. Cullen, Theresa Cullen of Pima County, who's the director of their Department of Health there, was appointed as the next director of Arizona Department of Health Services. Her appointment is upcoming, but she should begin at the end of February. So her focus is county and tribal relationships, and so she feels, why she's in this. So it's nice to have one of our own in there, and I know her, so it's already a great start. And then just to announce to the board too, I was elected as vice president of that board just a few weeks ago. So
Congratulations.
So be able to participate with that and have that connection for the county and that resource for us when needed, and also our connection to Arizona Department of Health Services. So, and that is it from an update. Thank you.
Yeah, it's a good way to end your report.
Yeah.
Very nice.
So this statement, this is Hunter Adams, and Dr. Kingsley. I just wanted to say thank you so much for all of your efforts in traveling up to Colorado City. I think being disconnected for decades due to the geography of Colorado City and the culture, it was very, it was difficult to reach in the last 20 years. And so I moved to the community about 6 years ago and helped to create the clinic about 3.5 years ago. And just seeing the changes in the community from kind of an inside view, I'm just really thankful for the county health department, and even just having myself just have a seat at this table. Because I really am just, committed to the health of the community up here in Northern Arizona. And if there's anything that we can do to support the county, we're happy to do that, speaking on behalf of Creek Valley Health Clinic as well. So thank you for all that you do.
Thanks.
Okay, thank you, Hunter. And I think in past years or decades, we've kind of looked at the area up there as being beautiful, but it's on the other side of the Grand Canyon. And now that we know it's just a ditch, it simplifies things. So thank you very much for educating us in this part of the county. And I think we have closed the gap of that small ditch that we have to cover. Thank you,
Absolutely.
Hunter.
Thank you. And I think if there is a silver lining of COVID, I think it's the connection through virtual means of communication. And so I'm just so fortunate to be here remotely. It's about a 6-hour drive. So thank you all.
We have virtual meetings now, and the sheriff's office has that new plane that is able to get there rather quickly and carry more than just one person. So, yeah, it's all coming together, and we're proud of our county and all the communities. Okay. Next is the business to come before the board. We'll start out with the discussion of possible action. Reference the MCDPH Board of Supervisor board actions.
So this is just bringing before the board and planning out. We're in the middle of our fiscal year, but kind of coming to my 6 months and the board and working actively to fill the board. But I've also noticed, as I explained before, that this is a mandated board, and it's to be able to reference those health decisions that occur within our community, and as well as advise the Board of Supervisors as matter experts within the field and the community and the health that is occurring, to be able to advise them. And so taking that, I'd like to be able to continue and promote the board to be able to have a participation with their supervisors and the supervisors on those points. So we have our 4 scheduled meetings during this year, but I would also just like to advise the board, and if it's appropriate for them, that when needed, and it might just be a monthly basis, we would have a Teams meeting probably anywhere from 15, 20 minutes to approve our board action forms that we're going to take to the Board of Supervisors, my department. So if it's a new grant, or if it is information, that we bring it to you and let, so that we know kind of the direction of our community, and then provide an advisory position to the Board of Supervisors. So, if we're getting a new grant, or we're re-signing a contract, or a point that the board would like to know, then we'd have that short meeting. This would be for our board action forms that we take to supervisors, and so that I can put in the Board of Supervisors recommendation in that memorandum or presentation. And so considerate of your time, any other meetings would be, again, either Monday or Friday at, or a Monday in the morning, maybe 20 minutes as needed for a quick discussion, and this is what we're taking to the board. So I just wanted to get the board's feel on that, if that's appropriate for you and your time. It would be, again, a once-a-month meeting that would be over Teams between our other meetings, so.
So just based on my experience as a member of the Board of Supervisors, it's very helpful when, say, the Planning and Zoning Commission puts their little line on there that
Yep.
it's recommended or that it's not recommended. It's helpful to the board to come to the conclusion and to help make that decision. So I think that's a good idea. Do we need a motion to go forward with that, or is it just administratively?
So,
To have a Teams
I
meetings?
believe in ARS, so the two people that can call a meeting is myself and you, the chair. And so administratively, I'm able to schedule a meeting without board action. And so, yeah.
so if we need a board like this kind of special meeting, other than the 4 times a year, then we still need to have an open meeting
Yeah,
laws.
and we would meet, it would be a Teams meeting, but we would still provide public comment, and it would be posted publicly.
Okay.
It would still follow administration. I don't think we need an action, but I just wanted to get a
Yeah.
feel of the board.
So, yeah, if we follow the public
Yep.
open meeting law, then we can do that.
Okay, great.
Gene, I'd like to put an action on the board, on the minutes anyways, because I think that these meetings are very important. And I think more important than we may think at this point, because I agree with you. I think it is important, and the Board of Supervisors never hears anything from this board, as a board. So I would love to see that. It will strengthen us.
So
I'd like
if
to
you
make
want to
a
put that in.
Yeah, if you want to put that
I'd
into,
like to make a motion that we do our best to attend team meetings called by our chair and our director of public health monthly.
okay.
Okay, very good motion. Looking for a second.
I'll second it.
Motion, and it has been seconded. All those in motions, please indicate by saying aye.
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 Any opposed? Okay, the ayes have it. Okay, we'll go on to the discussion of possible action, Mojave County Department of Public Health Division activity and update reports, beginning with Melissa Palmer. This will be administration.
Good morning.
Morning, Melissa.
I oversee the Administration Division of Public Health, and so in addition to being the assistant to the health director, I also oversee Public Health Emergency Program, and that particular program right now, they are they're updating their plans, including their mass casualty plan and creating a family assistance center plan, and that mass casualty plan is an item that all of Mojave County entities that would respond to a mass casualty incident. So that includes fire, that includes law enforcement. And, if there's biohazard waste involved in it, then those entities, how they would then go through that situation. So who's going to handle the traffic incident that comes from that, who would be the one that would be handling if there is any casualties from it. So the medical examiners involved in this, all of our law enforcement entities are going to be involved in it, and the fire EMS will be involved in it, in addition to anybody else who's identified to be involved. Then the creation of the Family Assistance Center, that is something that out of the Las Vegas shooting event that occurred, that was a lesson learned. And so a Family Assistance Center plan is going to be put together, and that would fall more under public health than any of the other entities. A mass casualty event, that's going to fall under fire or law enforcement mostly. The Family Assistance Center is really where public health would come in. We would ensure that there was a location for it, that it was manned by the appropriate individuals, that we had the supplies needed, that we had everything in place for that.
Do we include emergency management with those plannings?
Yes, actually Jasmine's at the table with them as they're going through both of the plans right now. And of course, Byron Stewart and Mike Browning are involved too. Okay. And then they're also working to reestablish the tribal communications and relationships. During COVID, we had our points of contact for all the tribal entities. However, there was staff turnover after COVID, during COVID and after COVID, there was staff turnover due to various reasons. And so now they're working to reopen those lines of communication with those who are now filling those roles. For our public health improvement program, which is another program that I oversee, and Barbara Kromchek's right behind me, she is working on reaccreditation. They just opened our portal in order to drop in all of our documents. We have 45 days to get those submitted. So that will be her main focus. And she's also working on 2 QI projects. These have been ongoing. One is what Cherie spoke about with the distribution of the naloxone. She added a form to the website for OD2A, or opioid data to action. And that form is going to allow entities to go online, fill out the form, and then get their distribution. And then the other one is an event calendar for the department. We have so many activities going on now that we're beyond COVID. All of our health events are coming back around. In-person opportunities for education and community outreach are coming around. And in order to keep track of who's doing what, and also if somebody's not aware of an event occurring, they can look on this calendar and say, oh, that's an event I want to be a part of too. So she's got that going on. There's an electronic version in Teams, and then there's physical versions of it in each of the offices. For our behavioral health program, again, another program I oversee, we did mental health symposium starting in December. We did Kingman on December 7th. Then we had Lake Havasu City on December 14th. And then unfortunately, right after that, there was a slurry of illness that occurred. So we had to cancel the Bullhead City one that was supposed to occur the following week. That has been rescheduled. It is now going to be on March 2nd. That's at Bullhead City MCC. And it will be from 11 to 2. The registration is available on Eventbrite, but we can send out that information after this meeting. And then lastly, finance. Budget season has started. Budget packets were sent out last week, and so we are working through the budget process. And I have a budget presentation later on, so I won't bore you with any of the details of that at this time.
Thank you. You're so kind.
She'll bore us later.
Anna, do you have anything for us under epidemiology?
Oh, sure. First, before I get into the communicable disease, I want to point out that I also do the child fatality review. And I have to tell you that fentanyl is sneaking into these kid cases.
Wow.
So that school connection And the education, kids, it's awful. It's an absolute tragedy.
Elementary.
Yes, Watson?
Elementary school.
Well,
You saying that we're seeing it in elementary school?
I haven't seen it yet in elementary schools, but
I know junior high and high.
kids under the age of 18.
I know in December, so the medical examiner will call me, and he reported a 12-year-old overdosed in December from fentanyl, so.
What a sin.
Yeah, awful. So as far as the communicable disease is concerned, I've got your regular report there. One of the things that I will point out is that the counts, I pulled these counts, it's been about 2 weeks. I think it was January 6th that I pulled them. And it's all pretty good, solid numbers, more or less, with the exception of influenza, RSV, and those respiratory illnesses. The reason being, our big reporter of those diseases got way behind and wasn't able to catch up until later on. So we've actually tacked on in the past couple of weeks with that particular facility, getting some new people on board to make some reports. We've tacked on a few hundred influenza cases and a few hundred RSV cases. But the flip side of this paper here will give you a better reflection of those numbers. So we'll get to that in a second here. The other thing that I did is I did an aberration report, which just is fancy for comparing what we saw in this particular year in the 2022 counts compared to what we see in the 5-year median or average. And I'm glad to report that most everything we had in 2022 was pretty much normal counts. And the ones that were higher counts, at least twice as many cases as we normally saw in the median in the 5 previous years, were the carbapenem-resistant Enterobacteriaceae, the CRE, which I've been saying those numbers are going to go up. It's a new reporter, it's a new emerging illness, and those counts are just going to continue going up. So there should be no surprise there. And then the other one that was at least twice as high as the median was the E. coli, the Shiga toxin, the bad type of E. coli. But you got to point out in a county like this, when you go from a median of 1 to 3, okay, well, we've just doubled. But is that really, really significant? Probably not, unless something is happening there in the background. So you have to understand and look at it in the perspective of Mojave County. The ones that are lower than usual, at least twice as small, our counts were twice as small as the 5-year median, were the cryptosporidiosis, which is a parasitic gastrointestinal illness, and that was a little bit less than usual. And then pertussis. And I can't really address pertussis, except I will point out that pertussis, the whooping cough, a lot of times when you get one case, you'll get more than one case, because the case that's being reported might be a kid, and then we identify multiple household family members that are also cases. So that can kind of make those numbers fluctuate quite a bit. So we haven't done anything magical to stop pertussis spread or anything like that, but we did see lower counts than usual. I will mention that monkeypox, we haven't had any additional cases since the last time we reported out. I don't think it's disappeared, but we haven't had any additional cases there. The exciting stuff is on the back there. The first point is the rabies. We had some media attention that came through the Arizona Game and Fish Department about some rabid foxes that had been identified up in the Hualapai Mountain area. And there were 2 different instances with 2 different foxes. In one incident, a fox was acting really, really aggressively toward a person who was there, a wildlife officer that was there, and the wildlife officer was able to dispatch the animal, send it off to the state lab, and sure enough, it tested positive for rabies. At about the same day or time period, it was within a few days of one another, a person had reported being bitten by a wild fox up there. And so during the investigation of that event and that report is when a fox more or less emerged and again was acting quite aggressively. So wildlife officers were able to euthanize that animal, and it was shipped off to the state laboratory, and it was positive for rabies as well. The thing that I will point out is that we cannot prove that that second animal that was euthanized and tested was in fact the one that had bit the person. So there seems to be a little bit of rabies out there. What's significant about this is that we have not had rabid large mammals, foxes, skunks, nothing like that in Mojave County prior to this. It's always been bats. And for a historical perspective, the last rabid bat that we had tested positive in 2019, and that bat had bitten a person. So they got the vaccines that were necessary. And then prior to that, prior to 2019, was the last time. In 2014, we had 3 positive rabid bats, and I think they were all from the Bullhead City area. And they all had some stories behind them. So in the past 10 years, in addition to these 2 foxes, there's just been 4 other animals, and it's always been bats until this point. And what's the significance? I don't know what the significance is, but we'll see what happens with time. And I believe, at least with the first fox, I believe I saw that it was a bat variant that the fox had been infected with. So whether that fox had been bitten by a bat, or if a bat had bitten a fox, it passed it on to another fox, who knows? But we'll keep our eyes open for that. And of course, Arizona Game and Fish is on top of it. And that's exactly the partners we want dealing with that. Did you have a question or a comment?
I do have a question, Anna. I know that a fox is a pack animal, so can they spread this disease from one fox to another?
Yes, they can.
And if so, how do they spread it? Is it viral? Is it in the air? Do they have to bite each other?
It's usually a bite. So these are really aggressive. Well, it can go 2 ways. It's, it's infecting the brain. So sometimes the animals just turn completely docile. And so you'll see a fox or a bat, and that's not normal, because it's acting really, really passive, out at the wrong time of day, coming up to people for treats or whatever, just completely like that. Flip side of the coin, you can have one that just goes crazy and is really, really aggressive. And it doesn't take much to make them bite. So, if you have a litter of foxes or whatever, they can turn nasty on each other for no reason, no particular reason. And so it's usually a bite that's gonna spread it to another animal.
What is the range of a fox?
Oh, I don't know. Arizona Game and Fish would know that. So we haven't had rabid foxes before, but prior to this point, every other county in Arizona has identified rabid foxes. Some counties have big problems with skunks. We've never had a skunk either. So I don't know if this may be spread up through the mountain territories from across, geographic ranges or not. I do not know that.
Okay.
Same thing with bats. I'm not sure. I know some bats migrate, but the ones that we have around here, the brown bats and whatnot, I don't know how much migration they do or don't do. That's a good question, though.
Okay. Thank you.
Hopefully we won't be the first county that has a rapid burrow. I just thought there, I deal so much with burrows, or whatever, I never thought I'd deal with burrows in my career. Anyway.
It's fun.
So the rest of information that's on the back of the page there is our respiratory illness. The top graph is just kind of illustrating just boom, boom, boom. Yes, we have influenza this fall. Yes, we have RSV this fall. Yes, we have coronavirus still out there. So the graph starts at week 40, and so it's trying to start off the respiratory season, which we define in terms of CDC and the state reports and whatnot, early October. And so that gives you an idea just of what's happening with those 3, and sure enough, there's plenty. But what you've heard, I think it was probably around Thanksgiving time, maybe earlier November, we started hearing crazy stories about respiratory illnesses like RSV. At that point, it was RSV. Now it's a little bit more influenza that was just skyrocketing. So that second graph down there is where I have taken all of the RSV cases and all of the influenza cases, and I've stacked them on top of one another. And you can see an idea that while there's quite a few cases out there, this is just from a few reporters. It does not give any type of sense of really how many cases of this are out there. But again, if you look at those patterns, we can see that it's peaked and it might go back up. We don't know yet. But what I really want to point out there is that those stacked numbers are for this season, and the little dotted lines below is the 5-year median. So there is a reason you are hearing about that in the news. Yes, indeed, incredibly high numbers of RSV and high numbers of influenza now are taking over there. So that's what I had to point out and mention. Any other questions or comments?
Questions or comments?
Excellent.
Dr. Nett?
This RSV and flu season, a lot of place, the pediatric population are really suffering a lot. I'm glad that we didn't have to deal with that so much because we don't have a pediatric hospital in our county. Most of our hospital here, the 3 or 4 hospitals we have are mostly adult. So when the flu RSV season came through, I was really worried because our hospital, a lot of time had to ship the patient out to other facility with the pediatric service. And when those hospitals are full, we don't have any place to send the children. So I'm glad that we hopefully taper and based on our data.
Absolutely. And I'll point out that we don't do a whole lot of investigation with any of those influenza or RSV cases. So I can't even tell you how many are hospitalized in dire straits too.
Anyone else?
Thank you.
Thank you, Anna. Okay, Tara Stanek from Environmental Health. Do you have a report for us?
Good morning.
Morning.
Good to be here. So I'm going to report out this morning on some of the activities, accomplishments, challenges, and changes of the EH division over the second quarter of this fiscal year. So our division has 3 primary programs. The first is the Food Safety and Sanitation Program, where we do our public health inspections. This is a mandated program through our delegation agreement with the Arizona Department of Health Services, and I'm just going to rattle off some numbers for you. So in the second quarter, we conducted 844 establishment inspections, 27 establishment complaint investigations, inspected 89 temporary events. In addition to our public health inspections, we also do educational services, so in the form of food handler and food manager classes and certifications. We conduct the food handler classes monthly in each of the 3 primary cities, and we do the food manager courses quarterly and proctor those exams. In addition to the standard classes, we also provided 2 special courses at Lee Williams High School and then Kingman High Schools, and they incorporate this as part of their nutrition courses. So moving on to our second program.
Tara, I do have a question. What is our procedure or process in handling complaints from the general public as far as food inspections, complaints about restaurants?
The complaint comes in either through our portal on the website, or they call in and our permit tech enters it. Usually the inspectors follow up in the first day, but they do.
Do we take anonymous reports?
Pardon?
Do we take anonymous reports, or did we change that when COVID came and we had all the controversy over anonymous reporting?
When it comes into for the food safety, if it's an establishment complaint about the food safety and sanitation, they can be anonymous. It's not the same as like with our nuisance complaints where we don't inspect those, but because these establishments are permitted, we are required to inspect them. We have the authority to inspect them, and so from my understanding, we are authorized to follow up on anonymous complaints, as opposed to where in the nuisance program, where we wouldn't.
Okay, Dr. Kingsley, I believe during the initial COVID controversy, there were some anonymous complaints coming in that the health department acted on, and I believe our board instructed the Board of Health to not act on anonymous reports because some businesses were reporting themselves so that they could complain later that, you know, it was, it got to be very,
Messy on those points. We'll look into that. Let's go and look on that from
let me look
that board
into-
action there, and also we'll review ARS if it, you know, if any statute there that says it can be anonymous. There's always, even from social media, you know, or stuff, or the Yelp and different things, some individuals would take it upon them to try to diminish someone else's business.
Exactly.
So it's, yeah, that has to be considered for.
if you could check into that, I'm sure all the board members would appreciate that.
Okay, thank you.
Yes, we'll do that, absolutely. Okay. Okay, moving on to our second program, which is the Smoke-Free Arizona program, which is another mandated program through the delegation agreement with AZDHS. This delegation agreement came up for renewal and was approved by the Board of Supervisors on the January 3rd meeting. As was mentioned in that meeting, our approach in enforcement in that area is really through just bringing awareness and re-education to the establishments. And the inspections are conducted in tandem with our food safety inspections. So they're just done together. And in quarter two, there were 5 complaints, 3 complaint investigations. 2 of the complaints were in the same facility, and one of the complaints was in regards to vaping, which is not covered by the law. On our nuisance and vector control program, we had 43 nuisance complaints, 53 complaints investigations, 10 of which were follow-up investigations, 12 notice of violations, which is just a notice that's given to them, just making them aware that they aren't complying with the laws and regulations. And there was 1 abatement of bees in a bee colony that was threatening the residents of another property, so it had to be abated. 2 of our accomplishments in the last quarter was, first, we've had 2 of our inspectors pass their registered sanitarian exam, which increased the number of our registered sanitarians from 2 to 4. The second major accomplishment was that beginning in the second quarter, we had 278 past due inspections that are traditionally scheduled either once a year or twice a year. And this was reduced to 141 by the end of the quarter, so over 50% has been reduced. And this is important to really monitor these, because not only does it keep us in compliance with our delegation agreement with the state, but it also helps reduce the number of establishment complaints that we're seeing. So in months when I was looking at individual months, in months where there was a high number of past due inspections in a particular area, there were also a high number of complaints. And as those inspections started to increase and the past dues went down, the complaints also went down. So that's an important indicator for me when I'm looking at the information. Some of our challenges have been the understaffing of our registered sanitarians. We are still down 2 full-time registered sanitarians. We also had the resignation of one of our supervisors, which was an RS. And while we lost a registered sanitarian position, it also created an opportunity for us to restructure and realign the workflow in our division in a way that's a little more logical, and it's more effective and more efficient. How it was organized historically is that we've had 2 field supervisors overseeing 3 of the primary service areas of Bullhead, Kingman, and Lake Havasu. And so what we're looking to do now is reclassify our office specialists as an office supervisor. So we're going to take that vacancy left by the resignation of the field supervisor and have that filled by an office specialist. And that office specialist is going to oversee the permit technicians, which are those people that sit at the front desks in each of our office and greet the public. And do a lot of the administrative work. So it makes sense to have those positions overseen by somebody who is in administration rather than by somebody who is in the field. And another responsibility is we're going to have that office supervisor absorb the administrative tasks that have traditionally been performed by the field supervisors. So timesheets, time off requests, some aspects of the performance reviews and things like that. And hopefully that's going to allow us to leverage their professional strengths and streamline their job functions in a more logical manner. And it's also going to help us to reduce personnel costs.
Sounds like a great reorganization. I mean, it's unfortunate we lost a good employee, but if good comes from it,
Yeah, absolutely.
it's good to keep looking forward.
Another change was an opportunity to create alternative work schedules. So when I first started in this position, I met with each of the employees individually in one-on-one discussions. And what I was hearing a lot of was that they wanted to work 4-10 schedules. So I worked with Chad and we developed an alternative work schedule just for our field workers at this point, because we can't have our office personnel working 4-10s, to where it's hopefully going to increase employee satisfaction and employee engagement in the workplace so that they can experience a better work-life balance. And hopefully down the road, we'll also see that it leads to less unscheduled time off and less call-offs. So, and it was just implemented at the beginning of this year. So time will tell and see how effective it is. And that's all I had.
Okay.
Can I ask you a question about the 4-day schedule? Do they all work the same 4?
No, because we always have to have an inspector available.
Yeah. All right. 10-hour shifts. It sounds encouraging. Wish I could get that.
Instead of the 15 one?
Yeah, absolutely. Okay, so we'll go into nutrition and promotion. Brenda LeBeau.
Good morning to the Board of Health members and the participants in the Board of Health meeting. My name is Brenda LeBeau, and I'm the manager of the Nutrition and Health Promotion Division of the Mojave County Department of Public Health. I have been in the manager of this division for about 6 months, about the same time as Chad Kingsley. My background, I've been with the Department of Public Health now for between 20 and 25 years. Minus a year and a half.
I'm glad we snagged you then.
Thank you. Thank you. I have loved my experience working with the County Department of Public Health. My focus, my background has been in WIC and nutrition and health promotion as the registered dietitian and lactation consultant for that program for a number of those years. The programs that I do manage include 8 different programs: the Prescription Drug Overdose to Action Program, as well as the Overdose Fatality Review, the Mojave County Tobacco Use Prevention Program, the Senior Nutrition Programs, the Healthy Arizona Policy Initiative Program, Arizona Health Zone, WIC, and the Associated Breastfeeding Peer Counseling Program, and a portion of the Maternal and Child Health Block Grant. As far as some of the accomplishments our programs have had, I'll cover some of those, as well as the challenges that we've experienced within our division. First, to give you a little bit of overview, the Arizona Health Zone, Sarah Hancock is the program coordinator for our Arizona Health Zone. And the Arizona Health Zone supports communities in Mojave County through multi-level interventions and encourages those who participate to make healthy changes and to create healthy environments in homes, schools, and neighborhoods through direct education and guidance for policy system and environmental changes. In order to qualify for their services, the qualifying site locations must have 50% or more of the population at or below 185% of the federal poverty level. Schools can qualify at 50% or more of the free and reduced lunch or 40% or more of the community eligibility provisions. So as far as what the Arizona Health Zone has done is they have attended community health fairs, provided food demonstration and nutrition education at the Mojave County Senior Centers, the Club for Youth, early childhood education centers. They've conducted the Seed to Supper gardening and nutrition education classes and school assistance with setting up school gardens. They've also worked with the Parks Department to help with the trails for hiking. And recently their Seeds to Supper gardening program has been widely successful, and that they recently had 50 participants at a recent program in Kingman. So that was really quite the accomplishment for them. Some of the challenges with that program has been some budgeting concerns, but we have moved Sarah Hancock over into our HAPPY program, which is the Healthy Arizona Policy Initiative program. She has moved over some of her responsibilities to that program because she goes into the schools, and she also helps out with many of the other programs that she works with through the Arizona Health Zone. So that was a good partnership for her for the HAPPY program, and a little bit more about the HAPPY program in a minute. So the Healthy Arizona Policy Initiative program is a program to help with education and increasing awareness for things like heart disease, skin cancer, or cancer, excuse me. Sorry, I'm forgetting the other two focus areas for that, and I will get that for you at a later date. But the focus in that program is to reduce, to help provide awareness and reduce the incidences of diseases through education and awareness. And she has recently revamped some of her action plans to help with the coordination of this program. She is working with Mojave County Department of Health as well as Mojave County to help with the wellness policies and to help with the guidance of policies and procedures. She is also, she recently acquired 8 blood pressure cuffs, and she has developed a plan to put those cuffs in the senior centers for seniors to help monitor their blood pressure and provide them with education on how to reduce blood pressure if they have the high blood pressure, or what to do in case the blood pressure's numbers are up and above what's recommended. She is also working in some of the early childhood education centers on sun safety and with prevention and skin cancer prevention activities. In addition to that, she is coordinating, her focus is to coordinate at least 3 trainings for ACE and trauma-informed care to 3 stakeholders in Mojave County to increase knowledge of mental health challenges and reduce chronic disease risk factors. Our next program is the Overdose to Action Prescription Drug Overdose program. I needed to hear from Cherie Minter about her program and what they have been doing. She also did complete a 10-week cohort of 4 teenagers in the Juvenile Detention Center. 3 out of the 4 teenagers graduated from the Hope Garden program and were released back to their parents. So in addition to that, the community health education specialists in her program have partnered with the AZYP program, Probation and Not My Kid, to establish and begin implementing a diversion program in the Lake Havasu City School District. I think they're working on the Bullhead City School District as well. And they also have collaborated with Recovery Court and Health and Wellness Court to establish a more streamlined orientation process for their participants. They have participated in a wide variety of community events, not only their program, the Arizona Health Zone program, as well as the Mojave County Tobacco Use Prevention Program, the WIC program, have all been a part of being more involved in the community health fairs and events that have gone on in Mojave County. And with our Mojave County Tobacco Use Prevention Program, Stephen Huft is the program coordinator for that program. And the Arizona Department of Health Services developed a quit line for the Arizona residents in 1995 to help people quit any type of tobacco products. This quit line is called Ashline. I don't know if you've heard of it. But in November of 2022, the Ashline transferred contracts from the University of Arizona to the National Jewish Health Organization. At that time, we received a last report from the University of Arizona that showed our provider contacts between January 2021 and November 2022 had a total of 96 sites. So during that same time, our county referrals to Ashline from these sites totaled about 278. So according to the reports that we have received, Mojave County is one of the top 3 counties to utilize this resource. Also, Mojave County Tobacco Use Program partners with the Arizona Attorney General's Office and the Food and Drug Administration to complete compliance checks with the Arizona tobacco retailers. From January 2021 to December 2022, 183 tobacco retailers were inspected on the compliance with state laws prohibiting the sale of tobacco products to minors. During this period, Mojave County's inspection fail rate was reported at under 10% each quarter, according to the Arizona Tobacco Retailer Inspections website. And then during the year, the Mojave County Tobacco Use Prevention Program has 4 emerging products education involving vaping education and/or anti-tobacco nicotine education presentations and/or activities to school, community members, business, and youth based on action plan written by their youth coalitions. They've provided education to 557 students in the schools throughout Mojave County, as well as 1,540 participants in community events and 85 participants in their community education classes. Some of the challenges with that program is that they have 2 vacant positions that we're recruiting for. We just had a staff member, Dean Winrick, in Bullhead City, who accepted another position, and he's no longer working with us as of December 30th. And we've had a vacant position here in Kingman for over a year and a half. Our senior programs, we have senior programs, our senior nutrition centers are located in Kingman, Golden Shores, and Lake Havasu City. In Bullhead City, the city is responsible for that nutrition program. Unfortunately, our longtime staff member, Rena Arnold, who has been with the program for about 30 years, she's been a longtime Mojave County employee, is going to be retiring on February 10th. And so that'll be a big loss for our program because she has done quite a bit with the senior programs in the area. So for the 3 sites, and I have data from September to November, the senior center served 23,006 home delivered meals, with Kingman being the largest site for home delivered meals at 40% of that number. Lake Havasu City, 34.7%, and Golden Shores at 25.3% of the home delivered meals for the entire program. 7,462 meals were served at the congregate meal centers. Lake Havasu City makes up for the most of those meals. They have quite a nice nutrition congregate meal site. They serve 65.8%. Kingman served 25.5% of the meals, and Golden Shores served 8.7% of these meals. So one of the things that the senior center in Lake Havasu City has is a site council, a rather nice site council. And so that site council, we are trying to establish that in Kingman. It was disbanded, I don't know how many years ago it was disbanded, but we are trying to restart that again. We are currently working, we've just voted in for the bylaws, and we have voted in for the community members to make up our quorum for our site council, and then we will work on moving forward with what our plans are. We have yet to establish a mission statement, but we will get there. Some of the challenges of the senior center include the increased costs of food, as well as utilities, maintenance costs for the equipment that we utilize to serve those meals and prepare the meals. And right now is losing Rena Arnold, which is going to be a huge loss, but we do have that program advertised for. And then we have the Mojave County WIC program. That has been one of my biggest challenges currently at the moment. When I came into the position, not only did my manager retire or acquire a new position, but also my supervisor, and then I lost 2 eligibility technicians, one in Kingman and one in Bullhead City. So my challenges have been trying to hire for those positions, as well as continuing to cover for the WIC program, since my position is not one that you can easily find. So through all that, though, we have maintained 90% of our caseload for the Mojave County WIC program. If you don't know what the WIC program is, it's the Women and Children, Infant and Children Supplemental Food Program. We serve children under the age of 5 and women who are pregnant and postpartum and or breastfeeding up to a certain age. It just depends on their category. In order to qualify for that program, participants must meet 185% or below for the federal poverty guidelines. Like I said, we have managed to maintain a caseload of 97%, but we are stretched at the seams. So when we get to be fully staffed, we are requesting a contract amendment to serve 3,500 participants. Right now we're at 3,400. And so hopefully that'll enable us to do a little bit more to help serve the 3,500. What we have done is we have contacted our state office and tried to not only do we have to do one-on-one counseling for those participants, we've also expanded our program to include online nutrition education classes. And so those would be an independent module that participants would have to complete in order to acquire their required nutrition education through that program. So that has been quite a help. And we do, so with that program, we do outreaches to various places, including physicians' offices, health clinics, churches, early childhood education centers. So.
Okay, thank you for that very informative report. You have a lot of hats to wear, and I appreciate you wearing those hats for us.
Thank you so much.
Thank you for
I
being
appreciate
part of
your time.
Mojave County.
Thank you.
Okay, Lynn Valentine, looks like you're up next. For nursing
As Lynn
service.
comes up, when during those last storms, you know, the Meals on Wheels that we provide, it was in Havasu Herald, but during the storms when the electricity went out, a senior citizen had fallen and wasn't able to get up, and it was the Meals on Wheels the next day that found him and was able to, you know, kind of a well check, but as well as delivering the meal and stuff. So that connection with seniors is so important, you know, with those Meals on Wheels, extremely, that they have that. I know here in Kingman, some of the only visits those individuals get are those Meals on Wheels. So it's an important part of our community and the health and well-being of our seniors. So.
Yeah, more so than just nutrition is that psychological connect,
They're
knowing
being
that
checked
somebody's
up on.
going to be at your door. So,
Yep.
Thank you.
Thank you, Lynn. Sorry.
Good morning. I'll just briefly be going over, I'm Lynn Valentine, Nursing Services Manager, and I'll briefly be going over the Nursing Division's fiscal year activity for 2022. And I believe you all had received a copy of our activity report, so I'll just go through that and highlight a few things. First, I would like to point out that there's a comparison of the 2 fiscal years. This year, or this past year, it looks like we did really super great because everything almost improved. But in all fairness, in fiscal year 2021, we had several clinics, or our operations were interrupted because we were still actively in the COVID response. So we didn't have some clinics and we weren't able to carry out all of the operations. So just briefly, each program that we have listed there, the first one is our high-risk perinatal program. We've obviously increased our visits there, that the operations were interrupted. That's a home visiting program by our nurses to some of these babies who are in the NICU. We obviously increased the last fiscal year, and we intend to increase again this year. It's a really great program. We want to grow it. Childhood immunizations, slightly fewer children vaccinated, but more vaccinations given. So I don't know the rationale behind that, but as far as the number of children dropping and the vaccinations given increasing, not quite sure, but we can definitely look into that. Our adult immunizations program, we have increased in almost all of those areas. I did put an asterisk because that does include our OC Health program, which is where we offer certain vaccinations and TB skin tests to some of our Mojave County employees who are in positions where it puts them at higher risk for coming into contact with certain diseases. And then our TB skin test down at the bottom, that also includes our OC Health numbers. Had 4 latent TB infections and 1 active case in the county for fiscal year 21-22, which is about on par with what is normally. And then our reproductive health numbers, our nurse practitioner has done a fantastic job, and our staff, our nurses and our front office staff, our clinic staff has done a great job of really getting that and growing it. And we have return patients, which is what we want, getting the word out about what a great program it is. So obviously you can see that we've had quite a few more new patients who have come on board with our reproductive health offerings. And then right below reproductive health is our sexually transmitted disease program. And that's kind of a misleading number because besides our clinic visits for those people who come in just for STD evaluation or treatment, some STD patients are also included in our reproductive health. It just depends on if they're, which program they fall under, whether they're considered reproductive or if they're not. So our last program is Health Start, which is a home visiting program by education specialists. And our numbers went down slightly there. However, we've expanded into Colorado City with that program. And we already have families up there who are enrolled in the program. So we'll definitely see an increase in the visits for our home, for our Health Start program this fiscal year. I'm sorry.
Sorry, the Hep B and Hep A, before we skip it around.
Yes.
That's huge influx. What do you think?
That was probably most likely to our OC Health. You know, we have certain positions within the county. We offer the Hep A or Hep B vaccine or both. Right. And so that's where a lot of those numbers come from. And honestly, we had to play a little bit of catch up from the previous year. Yeah. On the second page, I just briefly talked about what we call our Youth Health Initiative Program. It formerly was known as the Teen Pregnancy Prevention Program. Just a couple highlights about that program. Within the past, I believe it was last year, there was a change in the state statute for teen pregnancy prevention programs in the schools. And basically, it is a lot more involved to get a teen pregnancy prevention program to come into a school. Whereas before it was the curriculum was provided to the school boards approved it, it was available for parents to review for 30 days, and then they adopted it and we could go into the schools and teach the program. The new legislation makes it where there are several more steps and it makes it a much longer process. So unfortunately, what we've seen across the state is that a lot of schools and districts don't have that time to invest in the adoption process. It's just very involved. So unfortunately, those programs have not been in the schools like they were before. So what we've had to do is we've had to pivot with that program. We have rebranded with permission under the state health department. We've rebranded the teen pregnancy prevention program and we call it Youth Health Initiative because we feel that name gives it a better idea of what it involves because it's much more than a sex education program. It has, I've listed a couple of the programs that we offer through that program, such as the mental health first aid, active parenting, and then they also can do hygiene, lessons that are age appropriate. And then of course we still have the sex ed program component. So we've really had to look at getting into the community as opposed to staying within the schools. We have been having some success there. It's been kind of a challenge, but we are getting the word out and our Youth Health Initiative team is really good at doing outreach and promotion. But there's just so much more to it. And it's a really great program and we just want to make sure that we're getting out into the community and reaching these youth because we're not able to do it through the schools. And just the bottom paragraph just kind of goes over some of the things that the team has been doing for the past quarter, just to give you an idea of what direction we've been moving in. And then finally, I just wanted to mention that our STD, I briefly spoke about that, but our STD program, really excited because this year we're getting additional funding to hire a full-time STD communicable disease investigator. So that person will be completely devoted to investigating STD cases, which I guess sounds exciting to me. It might not to everybody else, but they can be really involved, especially syphilis cases. And right now our nurses have to take those on, which they already wear many different hats. But this person will be able to devote their time to investigating STDs, doing outreach, getting out into the community, providing education. So we're looking to fill that position. Actually, it's posted right now. No, it's not. We're working on that. We'll be getting that posted soon, so we'll have a full-time position in the STD program. And then, of course, our mobile health unit. We've got that coming up, and we have hired a nurse practitioner who starts next week, so we'll be able to hit the ground running with our nurse practitioner. We're going to bring on a medical assistant who can assist her with the unit, and I do believe that Dr. Kingsley will be speaking more about the mobile health unit here in just a bit, but we're just very excited about it, especially to get a nurse practitioner, a provider for the unit.
Now that one I can get excited with you.
Yeah, it is exciting. Yes.
Thank you, Lynn.
And just to touch base too, Lynn worked with risk management and Byron in response to the fox rabies incidents. And so now we are providing any eligible staff that, such as in the Parks and Recreation, the preventative at cost, which is significantly a lot cheaper than going to a hospital on those points. But we worked with them and able to provide that to any county staff that could possibly be exposed, and they're being provided those preventative vaccine for it. So yeah, just wanted to acknowledge that for Lynn too. So thank you.
Okay, I'm sure our park rangers appreciate that.
Yeah.
Okay. Item number 3, this will be a discussion on possible action for the budget presentation.
I just wanted a quick update on the complaint investigations. I reached out to those a little more familiar with the process than me, and the complaint is taken, and once it's taken, if it's anonymous, it's closed out and it is not assigned to an investigator, so it is not investigated if it is anonymous.
Okay, and the person is told that that's the procedure
Correct, correct.
Thank you.
Okay, good morning again. So the budget that was released last week, the budget packages, our department, what occurs is first we open those budget packages within finance and the admin division. We have worksheets that each of the managers get to work within for their particular program budgets. We plug in all of the internal services costs and the payroll, so salary and employee-related expenses get plugged in, and then those budget worksheets go to the managers, and then it's up to the managers then to determine what their budget will look like outside of those expenses, because we already know what salary is going to be and the internal services. It streamlined the process for the managers to not have them go and fill in those parts of their budgets, and then I meet with them periodically during the process to answer any questions and to troubleshoot any items. If something looks off, we go over it. I reach out to the appropriate entities, whether it be IT expenses or fleet or something like that, and we work through that process. So today, the budget discussion that we have, there's our mission and vision. If you haven't seen it, we have our mission and vision on almost all of our presentations. So there it is. So the budget overview, our internal goal with fiscal year 24 budgets is to meet community and department needs while ensuring that we're practicing good fiscal stewardship. And then we also have to abide by the grant budget requirements. So we have it down. Well, I have it later on in the presentation, but we are largely funded through grants, and those grants are offered to local health departments through Arizona Department of Health Services, with the exception of our WACOG budget. Our WACOG budget, Western Arizona Council of Governments, that's the one that funds our senior nutrition program, and that one can go to anybody. It just happens that in Mojave County, Bullhead City has taken on senior nutrition programs, but no one else within the city entities have taken on senior nutrition programs. So we ensure that that program is able to exist in those areas. And then all of our grant-funded programs that have staff, those staff are 100% funded within those grant programs. So if they're doing grant activities, they have to be funded through that grant. The exception is our public health nurses, because they do wear so many different hats. They are split into grants, but they're largely funded by general fund. So these are our general fund programs. So administration, we are funded largely through general fund. We do have a couple of grants in there. Our public health emergency preparedness program is grant funded. We have 2 other streams from that particular, the FEP is what we call it, but we still have a little bit of COVID funding that's set to expire in March. And then we also have our public health improvement program, which is, it's about $59,000 of a grant that we utilize. Now, with the addition of our behavioral health coordinator, that came from marijuana tax dollars and SB 1847. So that's how we fund that position. Then our vital records program is funded through the fees that are collected. For general nursing, that's going to be your mandated communicable disease response, and then a portion of patient fees and small grant revenues included in that budget. And then tuberculosis control, it's a mandated program. We do have a little bit of TB funding. It's a very small amount. Off the top of my head, I want to say it's between like $5,000 to $7,000 is what we get for TB funding every year. So if we have TB cases, that's going to be coming from general fund because it's a mandated program. Then our county nutrition, that's funds 11% of our nutrition and health promotion manager, and the computer usage and the desk phone. And I believe that's it for that particular program. So the other 89% of our nutrition and health promotion manager, that's funded through the grants that she oversees. And then again, our senior nutrition program. So it is a non-mandated service, but leadership has elected to support it, and it is largely funded through the WACOG grant. There is a 10% match requirement through that WACOG grant, and the WACOG grant's made up of federal and state funding, so your SSBG dollars. There's a senior independent living component. Because senior nutrition program is really there to ensure that our seniors have the option of living as independently as possible and having a fulfilling life. It extends their time living independently where they don't have to go into a long-term care facility. So that's what the program's there for. Currently, fiscal year 23, of that 10% match, Mojave County is actually matching 38% of that grant. So our non-general fund budgets, we receive 30 plus grants, and those all require different tracking for different programs. We have our federal funds, which require us to abide by the federal regulations. We have state funds, we have lottery dollars, we have tax dollars that come from the sale of nicotine or the sale of marijuana. And those have different requirements, so we have to ensure that we have all of our documentation in order and our spending in order, and to ensure that we'll pass any type of audit that may come our way. Out of these 30 plus grants, we have the 2 COVID grants that I said that would expire at the end of the month. One of those is our ELC COVID funding, which was what funded our contact investigators during COVID. Because we're not doing that part anymore, and the COVID activity as it pertains to the investigations and the follow-up and ensuring that facilities have PPE, we're not spending those dollars, and so we've elected to send back the rest of the monies to the state. So we had an opportunity to extend that contract, and we opted not to extend that contract. Our environmental health and environmental health technology budgets, 2 different funding orgs, but they are funded through the permit fees, plan reviews, and food handler fees. And then occupational health is funded through a combination of risk management and the employee benefit trust funds. So this is what I thought would be a good visual to provide what it looks like for our funding. This goes all the way back to 17-18. So those first 4 columns, that's going to be fiscal year 17-18. And the blue line is going to be grants. So the blue line across, it's in various colors. Some are darker, some are lighter, but those are all of our grant funding. So you'll see in fiscal year 18 and fiscal year 19, our grant funding was about level. In fiscal year 20, we saw a slight increase. And then in 21 and 22, that's when we really saw the COVID funding coming through, including the ARPA funding that was added to our WACOG contract. WACOG did receive some ARPA funding, and it allowed us to provide meals to seniors. At one point, we were providing them for every day of the week within a month. So they would receive all of their meals. Some would be frozen, so that way they could heat them up on the weekends. And they were fed during those times where there was food shortages and toilet paper shortages. We actually had somebody donate toilet paper, so we were able to deliver those packages of toilet paper to our seniors during that time. The second line, that's going to be your general fund transfer in. So you can see the first year it's kind of a burnt sienna color, and then it's a gold color the next year. The third year it's a purple color. I did not choose these colors, I apologize. They just came through when I did it in Excel. And then the next year it's a coral color, and then the last year it's back to that goldish yellow color. So that's how our general fund transfer in has fluctuated through the years. We only get general fund transfer in for what we need. So it's every month we go through all of our activities, our costs, we bill the grants, and then what's left over after the grants have been billed, that is what we ask for as general transfer in. And that's for all of our programs. And then you'll see the third line. The third line is going to be the fees. So that's environmental health and some of nursing. There are some cash activities. So TB test, if they pay cash, that's going to go under fees. And then that fourth line is going to be transfer in. So that's if we have miscellaneous income donations, if we happen to sell something in surplus auction, and we get the money back, whatever was earned during that surplus auction. One item to note on this is that this is before the medical examiner. So we didn't get the medical examiner until late November 2021. And that has not been taken into account for the end of the fiscal year 22 because it was a half year. And so next year, when you see these amounts, the general fund transfer in is going to be substantially higher. And that's because of the cost for the Office of Medical Examiner contract. So for fiscal year 22, we were 55% grant funded, 21% was fee funded, 15% was general fund transfer in, 5% was miscellaneous income or donations, and again, that's going to be either straight up donations from a community entity or a private donation from somebody that would go before the Board of Supervisors. It also accounts for our in-kind contribution, which goes before the Board of Supervisors for our senior nutrition program. And then anything that was earned during surplus auction. 2% insurance, so that would be clinical services, but also our senior nutrition program does have a few clients on the home delivered route that is part of the Arizona long-term care, and so we're able to bill for those services. And then 1% was the HR EBT transfer in. So our strengths moving into fiscal year 24, we're consistently working through to increase efficiency through quality improvement projects and process examination. During the accreditation process in 2016, we formalized our quality improvement process across the department. So now all staff, managers, leaders, anybody who's working for the department knows that they can look at processes and suggest improvements. There's a QI process. We do have QI on the fly too, which is for a quick improvement on a program or a process, and those can be submitted to our public health improvement coordinator. We regularly evaluate our staffing levels and job duties. So we've moved to annual checks on our job descriptions. That was part of our workforce analysis that we had done last spring. And we also look at staffing levels and adjust as needed. And then seeking funding opportunities that fit within our strategic plans. And this is our updated strategic map. It's a little blurry and small, but the goals to the left, that's what we focus on for our overarching guidance for how we seek any additional funding. And then our challenges moving forward. So I'm sure everyone is aware, but there's an increase in cost, materials, supplies, and utilities. The one program that's been most affected by this, unfortunately, is our senior nutrition program. So we've seen everything from utilities of electric, water, trash. Those have all increased. Food costs have increased. And then staffing, we have one staff person out, and then with Rena retiring, that's going to create some challenges there. We're continuing to work with the recruiting and retaining of qualified staff. I have to say we are in a better spot than we were a year ago, absolutely. However, we don't want to rest on our laurels, so we continue to work and strive forward to ensure that we can recruit and retain the best staff for Mojave County. And then we're also balancing workloads with staff training needs. We do have a workforce training document, and workforce training was something that came out of our workforce analysis that we had done in the spring. And so that is something that's constantly an item that we're constantly trying to work on. Unfortunately, we also have to work on everything else. So, it's something that we're continually coming back to. We are having meetings starting in February to update our workforce trainings and make sure that they're appropriate and not something that we're just doing to check a box. We want to make sure these are things that are valuable and that they're sticking with everybody, and that if we need to review them more often, that we start doing reviews of those trainings more frequently. One other item, back to our challenges, cost of maintenance of equipment. And again, this goes to senior programs. They've got ice machines, they have walk-in refrigerators, they have cooling units. These all need to be maintained, and it costs money to maintain that equipment. It's cheaper to maintain it than to replace it, but either way, we're incurring a cost there. So looking ahead for the remaining fiscal year 23 and into fiscal year 24, we do have the grant program updates and new funding opportunities. Brenda did share about WIC, so we're looking forward to receiving more funding for WIC. And then the case investigator for nursing, that's another opportunity that we have that we're excited about. There's also another workforce training grant that will be coming around that is not tied to COVID. So the one that I'm overseeing right now, it's tied to COVID, and it's under COVID recovery. And so the activities that we have in there, when I do my reporting piece, I have to report back to state on how that works with COVID and how that's recovering from COVID. And the next stream of workforce dollars, we don't have to do that. It's just workforce dollars. So we're improving our workforce. We're taking our workforce to the next level, and we don't have to tie it back to COVID. And then we have fee studies that will be coming before the Board of Supervisors. First will be the nursing fee studies. That's going to be for clinical services. It hasn't been done since, nursing hasn't been done since 2011. So there has been some cost changes there. And then environmental health, I have on here 2014 was the last time that the environmental health fees were brought to the Board of Supervisors for a fee schedule change. Lots has happened since 2014, including the implementation of Acela, which is a web-based program from an outside entity. Prior to that, they were using, I think it's EHWorks or EH Apps, and that was an internal program that was created by our IT department. And so you can imagine us going out to an outside entity for that software. It costs a little bit more. And then another area for opportunity is the senior nutrition program. So what we anticipate, looking at the award that we got this year from WACOG, is that we will have to ask for an increase in general fund transfer in order to continue that program in Mojave County. And then, as always, all of our budgets, once they're approved by the Board of Supervisors, they are found on the website, Mojave County website, under Government, then click Financial Services, and then there's the budgets on the left-hand side. Any questions?
Okay, thank you very much. Do we have any questions, any comments on the budget?
Just first want to thank Melissa, and she hands down is probably one of the best financial people in the county, I would say, for any of our departments. She's amazing, and she is very fiscally minded and very detail-oriented for our community and how we spend our money. So I just wanted to point out the reason, not that we want to put anyone, budgets, everyone gets to participate in budgets, but it is part of the ARS that we have to bring our budget to the Board of Health. And so this is the process. So we wanted to create this foundation for you so that when we come in April, when we've done the budget process, you can provide that recommendation or what's needed to the Board of Supervisors. And also, if you see something in the community that needs to be funded and you want to direct that towards that, that's part of the process. But just wanted to just point out that this is part of the ARS process of the Board of Health for us to recognize our budget and how are we meeting the needs of the health needs of our community, so.
Okay, is the budget for the wellness van included in this?
It's part of ARPA and won't be included for another 2 years. It'll be covered by ARPA till 2025 or 24.
I think it's 24.
Yeah.
Although we are going to seek funding or if we can work it into one of our existing funding streams, we do have long-term plans to ensure that that's something that's funded moving forward for as long as we can make it happen.
One of the, just a short update about the opioids, but we are receiving opioid monies foreseeably for the next 18 years. And part of that is a mobile unit. So we do have, so if we distribute naloxone to our communities from the mobile unit, then that could partially help fund it. So we do have a stream to be able to maintain it longer after ARPA too, as that's one example that we can pull from initially. But yeah,
kind of why
but
I
we
asked
will,
that question,
yeah.
to make sure that we could get some of that opiate money invested in the van.
Yeah.
So do we need a motion to approve the proposed budget?
That would be in April, so we'll bring this is the foundational part, as explained to you, and then we'll need a motion in April for you to approve and move the budget forward. So.
All righty, thank you very much.
Thank you.
Okay, so let's go on to the opiate settlement monies update. Dr. Chad?
Yeah, so as part of opioids, and it's gonna get more traction and once it's noticed in the amounts, but previously due to the opioid crisis that many states have undergone, it began first by individual lawsuits, but 43 states and their local authorities joined together to do a class action settlement with various organizations, and those companies have settled. So this is not federal money, this is not state money, this is money resulting from legal action. And so those monies have begun to be distributed. We're, as you can see, we're above 62% being funded by grants, and so we're very controlled by grants, and then suddenly we have money being presented in a way that's not a grant, but is similar. I do happy to report that after Maricopa and Pima, this doesn't always happen a lot, but Maricopa and Pima, but Mojave County is the next highest awarded within Arizona. And each of these these fundings will vary. The longest is 18 years, some are 9 years, some are 6 years. And initially we thought it and paid out in installments, and as well as each 4 of our incorporated cities also receive a percentage of that. The county receives about 62%, and the rest are distributed to the cities. As part of the legal settlement, besides a larger Maricopa and Pima, they had to form a council, but when it wasn't, then it was designated to the Public Health Department to distribute that money. It's directed by the Board of Supervisors and those points, but I believe as we evolve as the Board of Health to be able to recommend to the supervisors, we see this in our community and we would like this to be considered for funding. I did take the initial 2, we're starting the process with the Board of Supervisors under the recommendation currently right now is to begin to look towards funding the release program with Captain Bischoff that provides mental health as well as being able to provide a new start but with resiliency for those that have been in the criminal system to be able to provide them the stability they need so they don't return. And so funding into that. Next was to research, to go to our community and see what they, especially those with their, their feet on the ground, what do they recommend? And then lastly, increase access to care, possibly through telehealth or 2 points, access to care, possibly telehealth, and the other one is prevention, which we have prevention measures in place, but how do we increase that prevention for those purposes? We recently were just awarded, so on an ad, we were going to be getting possibly about $500,000 a year. The remaining CVS, Walgreens, we have received Walmart and we have received Janssen & Janssen's settlement, and that was going to be just about $400,000 a year for the county. But all the other parties just settled, so we could be in over $1 million a year. I don't have the budget completely for it yet, but that'll be going for it. So it'll be a continual process, but I'd like to involve the Board of Health as well as the Board of Supervisors who will direct it and do that. So we have great opportunities perhaps for grants, for our community, where that money can go to and how best it can be effective. But I think the overall mission and goal and direction of it is that we make sure that we're fiscally responsible with that money and that it is distributed to get to the right place and the right people and it's used most effectively. So it's a great resource for our community in the coming years. So at this time, I don't know if it's new or not new. I know Lake Havasu is not new. They've been knowing about it. They received, and their first disbursement from us is going to happen. If it hasn't happened, it's happening really soon. Melissa's handling that, so we started that process, and that's being distributed out to each of the cities. And again, a great resource for them as well, so be able to coordinate and work on this process. But any questions or any directions from the board or anything you would like me to take to the Board of Supervisors as a recommendation or advice?
Get all the money you can.
At one point, I think it was the governor who pointed to our county and said, you have the worst problem in the state.
Yes.
And our answer was, good, fund it so we can fix it.
Yeah.
Right?
Yep, and now it's our job to fix it, so
Yeah. So.
let's get all the money you can and
That's
let's,
kinda why I think we got so much.
Yeah.
Because we do have.
Yep. And it was, I always say, saying closed mouths don't get fed. We opened our mouth, we spoke about it, so, and so I think because, and to recognize Supervisor Angus, who put in a lot of time towards it and drove a lot of it. And because of that, we received this reward. So it's a great opportunity for our county.
And the cities didn't do too shabby either.
No, they didn't, yeah.
any other comments? Okay, moving on to the next item, be the mobile unit presentation.
I put Lynn's name there, but I'll just do a quick review. So we have received I was out of the office like 3 days last week, from Phoenix to Colorado City to Hualapai and all over. So I just wasn't able to coordinate as much with Lynn, but we'll be bringing pictures. But in the early part of February, we're going to have a park the van out front here, let the community see it, but as well present it to the media with Supervisor Bishop and begin that process. We have thankfully and happily secured a nurse practitioner, as Lynn mentioned, and that will make a large difference. So our overall intention to have received it, it's parked over at our fleet management. The decals have arrived, so we're just waiting for the decals to be put on. And Lynn and her department are securing the supplies for it. And at that process, then we're going to start our pilot program, thanks to me visiting as well as economic development meetings within our communities. We have anywhere from 15 to 60 emails of community members in each of our small cities. So we're going to start that email, hey, we're going to start our mobile unit, and references then in the side conversations after these small communities I visited. Currently, North Country has a van that visits once a month to a lot of our smaller communities. So we're going to stagger that so they can have access to care every 2 weeks. If that's a blood pressure or prevention or any type of, with a nurse practitioner, it opens the door for prescriptions, for minor, perhaps minor urgent care, in the sense of I have a sinus infection or something that we can help able treat, and so be able to help increase access. Our overall goal is that if we provide that care to those individuals in smaller communities, we can help reduce the caseloads that in our ERs. If somebody's showing up with a disease that really doesn't, something that doesn't really need to be in the emergency department, but we can provide those prescriptions and care there. As well, then also with it, as we've mentioned, naloxone, as well as education, mental health. So we're looking to do that, but start our pilot program, and what we're going to be able to provide. We're predominantly going to start in District 4, but and we're excited to go out to Meadview, Dolan Springs, White Hills, Chloride, and be out there, but then also start using it at our community events too. So it's there and recognized for childhood immunizations and clinics and where we need to. It is a great vehicle. Lynn and I had gone to a mobile unit conference, and we saw a bunch of different ones. We're like, oh, we like this, or I like that, and then it showed up, and it is very well built. And how it's set up, and it has a small little waiting room. It's got a small little bathroom with for any type of collecting samples. And then the back section it's got a full bed for examination, and that bed folds up, and so we have throughput. We actually don't have to go back out through the front door, so we can have somebody enter and they can go out the back. So, and even then if we need to, for any HIPAA or just more privacy needs, somebody can go out the back, and we can direct traffic differently. And so it's just overall, for meeting those basic health needs and everything we wanted, I think we got out of it, and it's a great design. It's very sturdy. We were surprised about how they put it together and just the overall feel of it. So we're very excited for this and what it can mean for Mojave County. And thank you for the ARPA money and for the funding on that, Supervisor Bishop.
You're welcome. It was District 4 ARPA money, but this needs to be the face of Mojave County wellness and health for the Public Health Department. So I'm happy to be able to expand that out to other areas where it's needed.
That's great. Thank you.
Thank you.
And that's it, unless there's any questions.
Any questions? Okay, then we'll go on to the COVID-19 advisory position to the Board of Supervisors.
So this will be an advisory position to the Board of Supervisors. So previously during the COVID pandemic, previously with chairman, when Supervisor Gould was chairman, the board put forward that my department would provide a monthly report on COVID-19 until the end of the year. And that was based in December. So as of December was our last report. We discontinued that report. What we noticed with the report is that we know we had a spike in December November, December. You do not see it anymore on the data reports. So similar to flu and RSV, with that people have home testing or because of vaccinations or previous infections, somebody that has COVID may have somewhat severe symptoms, but not something that takes them to the doctor or to the ER or requires hospitalization. So we no longer have more of an accurate picture of what's happening with COVID. But still, supervisors wanted an advisement and be brought back toward the board if we should continue that monthly report. We are transitioning the reporting to any of our normal reporting. What is received, we review that data. There is a lag between what the state reports, the states and their numbers. It's usually quarterly based for us in tracking, and we have to advise based on what we believe or see in our communities, such as Dr. Nguyen and his practice, and when we hear reports back, or from the hospitals that they're at 90% capacity. That's usually our indicators, what we do to advise the board in our community that we're seeing an increase of cases. Data is always delayed, but we don't want the community to feel in any way that we are not being transparent, that we're hiding COVID numbers or flu or RSV by discontinuing this report. It was my action. I did say, no, we will not continue forward. I don't see a value in this report, but wanted to take recommendation from this board to take to the Board of Supervisors in February. And so at your recommendation for it, should we continue with some type of monthly reporting or just the normal reporting and the process of our other diseases?
I agree with your recommendation in terms of become a normal part of healthcare. It is part of the, infection that we're going to deal with. And if we, as a clinician, see any change in the pattern, for example, the original COVID was really respiratory, now it's more systemic and less severe, then we will report to you and then you can report to the board.
Okay. All right. Do you see any worth in a monthly report? From our standpoint, we don't do a monthly report on flu. We report where needed and we advise. We don't do reports on, congenital syphilis. There's another disease that's plaguing us and different things. We don't have those other reports. And it's not that we don't want to do it. We just want to be efficient in it. Do you see any benefits still of doing a monthly report?
I think we could approach it just like flu because COVID is actually fit with the seasonal, cold season. So I think we can use that model, how we report with flu and similar.
Okay. All right.
Do you think that will be okay with the Board of Supervisors?
I'm not going to predict anything with the Board of Supervisors.
I agree with Dr. Nguyen wholeheartedly that.
We can only provide our recommendations.
Yeah. And, yep.
But I know that Jean has an in with the thought process, but evidently not.
I have connections with at least one member of the Board of Supervisors.
I'm sorry, Jean. Anyways.
Would you like that in the form of a motion to do that, or is it just administrative at this point?
I'll take a motion on it. Yeah, just as what the recommendation is, so.
To report it using the model similar to the flu virus.
Okay. The flu, or any respiratory virus. Okay, all right.
Yeah.
Okay.
And I second.
Motion and second. All those in favor indicate by saying aye.
Aye.
Anyone opposed? Okay, your motion has passed. Thank you very much. Are there any other items to discuss that you'd like put on the next agenda?
No, this was very all-inclusive, don't you think?
Well, since it's quarterly, we cram a lot more into where it's not much, stuff. So, but yeah.
Okay, and I will not say ditto. Thank you all for attending today. Hunter, always a pleasure to hear you on the phone. This meeting's adjourned.
Thank you.
I think your staff needs a wish list.